Hello, my name is Ida Shum, and I am the Business Development Executive, and I will be speaking to you about the disposable point-of-care device developed at Lawrence Livermore National Laboratory. There is a great need for point-of-care devices due to the outbreak of nosocomial or hospital-acquired infections, as well as community-acquired infections. Now, there's an annual impact in the United States alone of about 1.7 million cases. So this is quite a few cases for all the numbers of patients that are entering hospitals. And as a result of these cases, there are about 100,000 deaths. And from these deaths, the cost of treating these infections ranges anywhere from $4.5 billion to about $11 billion in cost. And this can range from antibiotic care or hospital stay if the patient needs to stay longer due to their care. So in this era of rising healthcare costs, it's imperative that we take a look at devices and tools that can be used to help, either detect and improve ways of treating people who are affected with these hospital and community-acquired infections. So many of these culprits that you will see, and maybe you've heard about them already on the news, are Methicillin-Resistant Staphylococcus aureus, Clostridium difficile, as well as Klebsiella pneumoniae. And a lot of these diseases we will find in patients who are immune compromised and are staying at a hospital. So a lot of times, you can end up in the hospital with pneumonia, and maybe you have a strain of pneumonia that is antibiotic that can't be treated because it's antibiotic resistant. So this will result in a longer hospital stay, difficulties in helping the patient recover from whatever culprit got them into the hospital in the first place. And there really is a need in terms of being able to detect whether or not a person has been infected with one of these organisms. So the idea is now to create more microbiology tests for detecting these diseases. And we want to reduce that cycle time from days to months to preferably minutes and hours. Because right now when a patient enters the hospital and they probably are carrying, or if they're carrying one of these diseases, it'll take a couple days or maybe 24 hours for the lab to check it. And a lot of times hospitals undergo precautionary measures and will put the patient on the highest type of antibiotics so that they can try to get rid of the bug. And in a lot of cases, this can cause further damage and complications to the patient who is coming into the hospital. So the reason why Lawrence Livermore embarked on this area is taking a look at point-of-care testing, particularly for foot and mouth diseases. And this really affected, there was an outbreak of foot and mouth disease in Great Britain in the early 2000s. And what this did is it's a very rapidly spreading disease that afflicts cattle and makes it very difficult for them, for people to then sell the meat because now it's been infected with this very deadly disease. And so what the agricultural agencies in Great Britain did was, rather than detect which animals had foot and mouth disease, they opted for the safe path of just destroying whole herds of cattle. And this devastated the cattle economy, as well as made it difficult for farmers who had to then rebuild their livestock. The other area in which Lawrence Livermore decided to embark in was taking a look at Methicillin-Resistant Staph Aureus. It is one of those infections that is now creeping up or is now present in hospitals. And so what we wanted to do was to come up with a device in which doctors and clinicians could easily use and detect whether or not MRSA was present. So here you'll see one of the papers that was published for Lawrence Livermore National Laboratory. The title of the paper is Development and Initial Results of a Low-Cost, Disposable Point-of-Care Testing Device for Pathogen Detection. And it was published in IEEE, and it was followed up with some coverage from Genome Web in terms of looking at this quick and efficient device. And the picture that you see actually shows the samples that have presence of methicillin-resistant Staph aureus. And it's very visible, in which you can see the ones that have and do not have the presence of the infection. The point-of-care device itself, as you see, is a relatively simple device. What we want to do is to be able to acquire the sample, so taking a swab and swabbing the area in which you think that there's an infection. So it can take a blood sample or a saliva sample, or maybe even the area where you would suspect the infection is present. And after you acquire the sample, we will put it into the tube and then inject reagents in there that will then enable us to isolate the DNA. And in that reagent mix is the capability for us to have nucleic acid amplification, or making copies of that DNA. And there is an external heater that is required. And after about 45 minutes to an hour, you will have, if the infection is present, you'll be able to determine just by looking with your eyes whether or not the infection is present. So there's a colorimetric indicator as to what's going on with the sample. So here you'll see the time series of images. So when we first start out, you'll notice that the samples all have a slightly purple tint. And if you look at it 15 minutes and starting at around 30 minutes, the sample colors start to change. And for this device, we have a limit of detection of 17 copies of DNA. So if we're able to make copies and there's 17 copies of MRSA that are present, you'll be able to see with certainty that the infection is present. So at the 45-minute mark, you'll see the samples that have tested positive for presence of MRSA. So some of the advantages of having a point-of-care device is that you have one single tube in a disposable device. Especially if you have a fairly infectious agent, you want to be able to contain it and also dispose of it. So what we have here is both sample preparation as well as nucleic acid amplification, all in a one-stop shop. It's simplified, so you have a single reaction vessel. And as you saw from the pictures, there's no detection instrument that's required. So you can just look at it through your own eye. And we have used some relatively inexpensive reagents and off-the-shelf reagents that somebody can also acquire. If you have any questions or comments, feel free to contact me. My information is posted here with my email address and my phone number. Thank you.